I'm Dr. Jeffrey Goldstein. I'm an orthopedic surgeon. I've been in practice since 2014. I specialize in adult hip and knee reconstruction, which is hip and knee replacements. I put a heavy emphasis on communication with my patients, not just explaining things clearly, but using language patients can understand, because the idea of surgery, especially hip and knee replacement surgery, can be very anxiety-provoking for patients. And though it's such a common problem, it also can be, at its worst, a very debilitating problem. My goal is to build a good rapport with patients, to educate and prepare them to ultimately perform a technically well-done surgery, and then to guide them along the rehabilitation process so they end up getting the outcome that they desire. I think that personality and the personal connection made between the physician and the patient is actually hugely important and has implications on patients' outcomes. And so that means being responsive to the needs of the patients, because so much about a patient's outcome is about what their expectations are going in, knowing what is normal, what is abnormal, and it's really my job to walk alongside them throughout that continuum. The goals for the patient would be to restore function and to improve quality of life. To be able to do that multiple times per week has been and continues to be very fulfilling. It's a gratifying experience to see my patients have great outcomes. What I find is, because we build good relationships with our patients, they're pretty reliable in coming back year after year just to say hi and discuss how their life is, and usually their hip and knee is a smaller part of the discussion at that point. I think Illinois Bone and Joint Institute as an organization has really evolved over time. I still believe in the 3 A's, which is availability, affability, and ability. And what we've really put an emphasis on is to build a culture of enthusiasm and passion for what we're doing for our patients in the community.